Welcome to EuroChat. My name is Steve Cooper. Along with having stage 4 prostate cancer, I also suffer from urinary incontinence as well as erectile dysfunction. We know it's a topic that most men don't want to talk about, especially erectile dysfunction. And so today, we have the honor of having Dr. Blick here with us. And Dr. Blick, we're going to talk about in depth about erectile dysfunction. So the first thing that we probably should discuss is, can you just lay the foundation for us as far as what is erectile dysfunction?
So erectile dysfunction is the persistent inability to maintain or sustain an erection satisfactory for intercourse. And there's a spectrum of disorder. People can have completely no erection whatsoever. They can have partial erection, where erection is just softer than they would like it to be. And then they can have sometimes an awesome erection, but they don't maintain it. I call that early detumescence. So you have this sort of spectrum of disorder.
And so what can cause erectile dysfunction? I'm sure it's a loaded question, but are there a few categories that usually apply?
Absolutely. Certainly there's a multitude of causes, but if you drew a ED cause pie, a big circle, and you said, what were the biggest slices of that pie? Well, you might say that the largest slice is going to come from, vascular or atherosclerosis or hardening of the arteries. So it's a vascular cause, like about 40% of the time. Another 40% of the time would come from diabetes, which is a very multifactorial etiology, but vascular included, but may also include things like hormonal issues or neurological issues included. And then there begin to be smaller pieces of the pie, like medications. There's a whole multitude of medications that can cause ED. Smaller pieces of the pie where people are prostate cancer survivors. Any prostate cancer treatment can actually cause erectile dysfunction. And even further down the line, there can be problems with our hormones, like, for example, testosterone, which can be a cause of erectile dysfunction, but it's usually, and not often known, but a much smaller piece of the pie.
Dr. Blick, you had talked about diabetes and the relationship with erectile dysfunction. Can you expand on that for us, please?
Yeah, sure. Well, first off, diabetics have a multifactorial etiology for their problem. Diabetics have a vascular etiology as well as a neurological etiology or cause for their problem. They can also have hormonal problem. Because of this multifactorial nature, they tend to present earlier and they tend to be more difficult to treat. Some of them are more refractory to the traditional therapies like oral pills and therapies, and many more of them are apt to get, for example, a penile implant as their ultimate solution for their erectile dysfunction, just because of the more difficult nature of their disease entity.
As you can imagine, when men call me that are recently diagnosed with prostate cancer, their number one concern usually is, are they going to be able to have sex? It's actually probably more important to them if they can have sex than if they're going to live long or not. And so if we think about that topic about being able to actually have intercourse, what are some of the challenges that you deal with as a provider trying to help men triage, if you will, what's important and what's less important throughout the treatment protocol, if that makes sense?
So if somebody is a prostate cancer survivor, it's not uncommon for us to talk to them about some of the side effects that can occur, like erectile dysfunction or male urinary incontinence, and we'll usually give them some information up front that this may be a possible consequence. Men who go through these treatments often are enrolled in penile rehabilitation programs early on with the hope that maybe some of them will move on to obtaining spontaneous erections again. So we get them, for example, on like Cialis daily or Viagra daily, sometimes even injection therapy to facilitate blood flow, vacuum device therapy, all inclined to try to promote spontaneous erections. However, there's going to be a subset of men that are going to move on and not be able to succeed because their nerves or arteries have been compromised either by radiation or surgery or other treatments for prostate cancer, for example. And those patients are going to move on to other treatment options that may be available. And there are a multitude of treatment options.
Sure. And with prostate cancer, is it the ability or inability to spare the nerve that's probably one of the best predictors of whether or not the man's going to have erectile dysfunction? And the reason why I mention that is when men call me, as well as when I see them post on social media, one of the first things they report is whether or not they're going to have a nerve sparing surgery. And it seems that they tend to hyper-focus on that one topic. And I'm not sure if that's valid or not valid.
It's very valid. You said it very correctly. In fact, there is data to support a sort of stepwise success rate in their success with erectile dysfunction based on how well their nerves are spared. So if they've had two nerves or both sides are spared versus one side is spared versus no side is spared, there's a sort of a stepwards degradation of the erectile function that parallels that. So certainly if you spare nerves, you have your best chance. If you've spared only one nerve, you have a lesser chance. If you've spared no nerves, you have almost no chance to preserve your erectile function.
What are some things that men can do to reduce the chances of erectile dysfunction?
So in general, when looking at the general population, I think the simplest things that people can recommend are just simply exercise, diet, weight loss, good sleep patterns. That really translates into better health overall. So when we say exercise, we just mean usually doing aerobic activity at least for at least 20, 30 minutes several times a week. When we talk about diet, we're just talking about eating a lower fat diet, moderating your calories, trying to minimize obesity, minimizing all factors that all risk factors that are for heart disease are also important for erectile dysfunction. So any way we minimize risk factors for heart disease, we're also minimizing our chance for erectile dysfunction as well. So exercise, diet, and weight loss.
The last question I'd like to ask on this topic here is, how does obesity play a role in erectile dysfunction? Because we're seeing a population of men that are becoming more obese, unfortunately, and then we're seeing things that are indicating there's more erectile dysfunction out there. I mean, for example, we're inundated now with Facebook ads, television commercials, groups like Roman and others that are saying, if you have ED, contact us. I have concerns about those. We can maybe talk about that later. But is there a direct correlation in what is causing the erectile dysfunction when a man becomes more obese?
Well, it's the same thing that I just mentioned. Anybody who is obese also is most likely having risk factors for heart disease, which means that they might be having higher cholesterol, they have higher risk for atherosclerosis, and ultimately they're developing a vascular insufficiency. But that being said, obese patients are more likely to be lower in testosterone, which can sometimes have an effect on their libido and their overall performance. But for the most part, we're dealing with a vascular insufficiency, which is a risk factor for heart disease. And so what's interesting is that men who have ED may actually be presenting early, sometimes 4 years in advance, for their heart disease that may present later. And so ED may be a predictor of silent heart disease for up to as much as 4 years in advance. Obese patients also sometimes are predisposed to developing diabetes, and they sometimes develop type 2 diabetes, which also is, as we talked about earlier, is a risk factor for erectile dysfunction.
You mentioned something I never thought of, and it's pretty powerful. So you play a much greater role than just treating not the incontinence, but in this case, the erectile dysfunction. Some of my concerns that I see in some of the advertising is that if you're having erectile dysfunction, call us. You'll speak to a doctor on the phone. We'll send you pills in the mail. But it sounds like there can be a lot more underlying reasons for the erectile dysfunction. So would you recommend then, in that case, the men see primary care providers, they see urologists, they really have an in-depth discussion and a screening, if you will?
Yeah, I think that there's a role. ED is a medical illness, and is, as you heard, a risk factor for heart disease that may be presenting as much as 4 years in advance. So I think there's a role for taking a more comprehensive approach, not just asking for pills and asking for an immediate result, but rather looking at this in a more comprehensive type fashion. So I'm interested in taking like a history and a physical and looking at certain laboratory analyses that might be predisposing someone for ED. There are many reversible causes for ED that we can get involved with, like we mentioned a little bit earlier. So if somebody had high lipids or high fat in their blood, we can help moderate that. If someone had low testosterone, we can help with that. Someone is predisposed to diabetes, we can help manage that. These are medical issues that we can help people out and have an impact on. So if I diagnose ED and no one else has ever, and that patient has never accessed the medical system, I sometimes refer them to a cardiologist because they are more apt to develop heart disease later in their life and would like to be preventative in nature. So we're doing a more comprehensive evaluation and then ultimately a more thorough evaluation for their ED, particularly like doing, for example, duplex Doppler ultrasonography and other things.
Sure, very enlightening, because those are things that don't come across in the 30-second ads or commercials. So I really appreciate the insight and how serious this is. As you said, it's a medical diagnosis, right? Exactly. It's an actual condition. So thank you. Dr. Blick, where can patients reach out and contact you if they have erectile dysfunction and want to have a workup and then look at treatment options?
So for more information, you can go to my website, drblick.com. That's spell out the word doctor. That's drblick.com, or you can call the number 602-931-4556, or you can check me out on my podcast, Blick's Dicks, which I'm trying to create a new metaphor for men's sexual health in the United States.
It's not Dick's Blicks, it's Blick's Dicks.
Blick's Dicks, and Blick can fix your dick.
Blick can fix your dick. There we go.
Thank you very much.
Fantastic, thank you.